Hello and welcome. We're working on getting everyone connected and we'll start our November office hours
Recording in
shortly.
progress.
All right, it looks like we have everyone in the waiting room in the meeting with us, so we will go ahead and get started. Please make sure your microphones are muted to avoid any accidental disturbances during our presentation today. We want to thank all of you for joining our November office hours. Every month we present a new topic. Office hours are held on the second Wednesday of the month at 11. The South Dakota Project Firstline team is employed by the South Dakota Foundation for Medical Care. We serve as contractors for the South Dakota Department of Health. We present infection prevention training and education through South Dakota Project Firstline. Project Firstline is the CDC's national training collaborative for healthcare infection control. My name is Rebecca Syme. I'm a registered nurse and I serve as the team lead. I am certified in infection prevention in the long-term care setting. I have a varied background in healthcare and the OR, SPD, sterile processing. I also have worked in the ED, med surg, so kind of a varied background. So with that, let's take a moment to allow the other team members to introduce themselves.
Hi, everyone. I am Jess Stanko. I'm the program director at South Dakota Foundation for Medical Care. I am proud to be a part of this great Project Firstline team, and I also work on the South Dakota Department of Health contract for healthcare-associated infections and doing the antimicrobial stewardship work through that contract.
Renee Robbins. I'm a registered respiratory therapist. I've been with South Dakota Foundation for Medical Care for about 2 years, and I've worked in public health preparedness and response projects. I'm currently working with Project Firstline and then also with the Dementia Dialogues Training Project.
Awesome, thank you. A couple of reminders before we get started today. Please feel free to submit any questions in the comments box. We encourage you to share comments, resources, links, ideas, even stories if you have them that relate to today's topic. The recording will be shared after the event. It'll be posted on the Project Firstline website, the South Dakota Project Firstline website. Please complete the survey at the end. We love to hear your feedback and it is greatly appreciated. Today's topic is antimicrobial resistance. We're going to have Jess and Renee both presenting for us today, so I'll let them take it from here.
Thank you, Rebecca. Today we're going to talk about reservoirs, so where the germs are, pathways, so how germs get somewhere else, and infection control and prevention, focusing on antimicrobial resistance and what we can do to stop the spread of that. Next slide. So here we have a fact sheet that you can find through CDC Project Firstline, and it really talks about infection control and how we can stop resistant germs from entering the body, spreading to people, moving with patients, and spreading into the community. So we're going to watch a video from the CDC Project Firstline to discuss the risks of how germs spread in healthcare. Next slide.
We're not hearing any volume, Rebecca.
Infections.
Does that help?
First,
I
germs
can hear it
Yeah.
here.
Yep.
Okay.
We call these places reservoirs, which are simply places where germs live, a habitat, if you will. Our bodies have many reservoirs for germs. 4 of the most important for infection control are the skin, the gut, the lungs and airway, and the blood. The environment around us has reservoirs too: water and wet surfaces, dry surfaces like countertops, dirt and dust, and devices and equipment. Recognizing where germs live is the first step in understanding how to stop their spread. Because when you know where germs might be, you can stop the risk and take action. For example, cleaning and disinfecting high touch surfaces, which are reservoirs for germs, kills the germs before they can spread. Second, germs need a pathway. They typically can't travel on their own, at least not very far, so they get from place to place when they are breathed in, by touch, or through splashes and sprays. Many of the things we do in healthcare also create new pathways for germs by breaking down or going around the body's normal defenses. Think back to our IV example. Giving a patient an IV breaks their skin and creates a pathway for germs on their skin or in the needle to get into their body. But disinfecting the patient's skin beforehand and using a sterile needle helps ensure germs don't spread to the patient. Third, germs need a person to infect. That person can be a patient, you or one of your colleagues, or anyone that enters a healthcare facility. Infection control actions like telemedicine, screening, and phone triage work because they simply prevent people from being exposed to germs. The fourth factor of infection: when germs get to that person, they need to get around the body's natural defenses. People with healthy immune systems can often fight back. But for someone vulnerable to infection, like our patients who are already sick and struggling to regain their health, germs are an even bigger threat. And finally, the germ has to survive in the environment while it spreads to be able to make someone sick. Note that these 5 factors don't have to happen in this order for a germ to spread. It's very important to perform infection control actions at any point to help prevent infections.
So the video talked about reservoirs, and we're just going to touch base on those reservoirs a little bit. So when we talk about a reservoir, we talk about the skin, especially our hands, and the hands carry germs and spreads them easily. So when we touch surfaces, germs can spread from those surfaces to other people. And the gut is another reservoir that's filled with bacteria and yeast, which are normally part of a healthy immune system. And most gut germs don't cause problems in healthy people, but they can cause infection when they spread. So germs in stool can spread onto hands and skin when we're wiping or changing a diaper. Then we talk about the respiratory system. Bacteria and viruses live in our mouth, throat, airway, and lungs. And if somebody's infected, talks, breathes, sneezes, or coughs, they can produce respiratory droplets that could spread germs. And, to touch base on that a little more, a sneeze can travel up to 100 miles an hour. So germs are also more likely to spread in places with poor ventilation or lots of people. And then also when we touch our face, those germs on our face can spread to our eyes, nose, and mouth and lead to infection. And the last human body reservoir we'll talk about is blood. So if you have a cut or a break in the skin, that can spread viruses in the blood and lead to infection. So things that can cause that would be needle sticks, reusing equipment like glucometers or multi-dose vials. And you want to keep in mind, viruses in blood can also live on surfaces and spread even when the blood is not visible. Next slide. So environmental reservoirs. So we talk about that. We talk about water and wet surfaces, dry surfaces, dirt, dust, and devices. And there's a lot of different germs that can live in these environments. So when we talk about germs that live in water, what type of germs do you think live in water? Any guesses? We have Pseudomonas, Legionella, and tap water is generally safe to drink, but it's not sterile and it can always have some germs in it. So germs in water can spread to surfaces and people and cause harm. So we saw that when we talked about splashes and sprays. Also, some medical equipment like oral syringes used to flush tube feeds can provide a place for bacteria to grow. So dry surfaces, we also have germs in dry surfaces, and that can include C. diff, MRSA, C. auris. So germs found on the body and in the air and in stool can be found on dry surfaces. And several of those can live for a very long time. So when we think dry surfaces, we want to think high-touch surfaces like bed rails and door handles, light switches. But it can also include countertops, beds, curtains, and floors, things that we might touch as often. So hands pick up germs from dry surfaces and move them to other surfaces and to people. Germs on dry surfaces can also get into devices and that are used on people or in persons. Germs also live in dirt. So when we think about dirt, one of the more common germs in dirt is Aspergillus, which can cause serious illness in some patients with compromised immune systems. Other ways we can think about dust and dirt is during construction, which can send dust into the air and carry germs into a healthcare facility. And then smaller construction jobs. So you think about construction jobs within your facility could include taking out parts of a wall, renovating a room, or removing ceiling tiles. So all these can create dust that have germs in them. And lastly, we want to talk about devices. So the germs that can live on devices include staph, MRSA, C. auris, and then gut bacteria like E. coli and Klebsiella. So when a device like a pulse oximeter is used on a patient's body to provide care, any germs on that device can be spread to places in or on the patient's body. So we want to make sure that we're not sharing medical devices and they're cleaned properly between patient use. Next slide. So how do these germs spread? We know where the reservoirs are. Now we want to talk about the pathways. So there's 4 main pathways for germs to spread from reservoirs in healthcare. And the first is touch. We talked about that. It usually involves the skin, especially the hands, but it can also happen with devices. Other pathways include breathing, and then splashes or sprays of blood, body fluid, or water from a sink or other source. So germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or break in the skin and cause infection. And the last common pathway is clinical care tasks that bypass or break down the body's natural defenses. So you think about inserting an IV, that creates a pathway for germs to enter the patient's body. Next slide. So standard precautions are the minimum infection prevention practice that apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. So risks will always exist in healthcare settings, and we need to follow standard precautions to protect patients and ourselves. So we're all familiar with standard precautions: hand hygiene, cleaning and disinfecting surfaces, injection safety, PPE, and we want to make sure that we use the right PPE the right way at the right time for the right task, minimizing exposures through source control, and cleaning and disinfecting reusable medical equipment between each patient. Next slide. So we're going to dive into standard precautions a little more. So when we think about hand hygiene, we need to remember this is the most important principle of infection control. So hand hygiene should always be performed immediately before touching a patient, before performing an aseptic task, before moving from a soiled body site to a clean body site on the same patient, after touching a patient or in the patient's immediate environment, after contact with blood, body fluids, or contaminated surface, and immediately after glove removal. So hand hygiene is the #1 way to prevent the spread of germs. And I think we all know that. We just need to be compliant. And then we talk about PPE. So we never want to wear the same pair of gloves for the care of more than one patient. And we always want to perform hand hygiene immediately after removing the gloves. And you want to wear gloves whenever there's a potential for contact with blood, body fluids, mucous membranes, non-intact skin, or contaminated equipment. We also want to make sure we're wearing gowns and other protective clothing during procedures or activities where we may come in contact with blood or body fluids. And then our mouth, nose, and eye protection during procedures that are likely to generate splashes or splattering of blood or body fluids. So respiratory therapists and nurses will often wear mouth protection, eye protection, and nose protection when they're performing suctioning. And a couple important reminders with PPE. You always want to remove the PPE before you leave the work area. So always remember to be prepared and bring everything you need into the room with you. Respiratory hygiene and cough etiquette. So we know it's respiratory virus season, so these reminders are always welcome. Cover your mouth and nose when coughing or sneezing. Remember to cough into your elbow and not your hands. And use tissues and dispose of them properly, then perform hand hygiene immediately after. And then remember to provide space and encourage persons with symptoms of respiratory infection to distance from others. Safe injection practices, we've talked about that. Sharp instruments can act as a source of cross-contamination if not disposed of properly. So make sure when you discard used needles or syringes that you use a proper biohazard container. And we always want to make sure that we're checking to make sure that container is not past the overflow line. And I think we see that often when we're doing ICARs or out in facilities looking for risks. So another reminder on needle safety is never recap needles after use. Many sharps injuries happens from recapping. And then cleaning and disinfecting environmental surfaces. So when we think about environmental surfaces, we're not only talking about countertops, we're talking about medical devices, pulse oximeters, glucose monitoring devices, stethoscopes. So we want to make sure we use the right cleaner or disinfectant that are approved for your facility, know your product, and know the contact time. So make sure you're reading those labels. Laundry handling. So when you dispose of soiled linens, carry the items to the laundry bin and keep those linens rolled up containing any infectious material and carry those linens away from your body. And the last standard precaution we're going to talk about is waste management. So if waste that is produced from a procedure must be disposed of properly. So if you're doing wound care, for example, discard the dirty dressing material into a bag. Tie it up when you're done to prevent it from potentially infecting somebody else, and discard it in the appropriate wastebasket. And that wraps up standard precautions. I'm going to let Jess jump in and talk more about pathogens.
All right, I am excited to be able to talk to you guys today with Antibiotic Stewardship Week coming up next week, and to really share on that. Once I wrap up, I'll give you some resources of what's going to be going on in South Dakota. I mentioned before that I work on a contract through the Department of Health for the healthcare associated infections, which includes the antimicrobial stewardship work. What that means for those of you on the call or anybody really across South Dakota in a healthcare setting is I am available to be a resource to you to offer anything such as education, resources, or put you into contact with other contractors throughout the state of South Dakota that work with the Department of Health to really provide some in-depth stewardship education, offer resources for your antibiotic stewardship programs, those type of things. So if you have any needs, even if you're just looking for some guidance or some resources, please feel free to reach out and know that that is what myself and my colleague Cindy Shook are available to do for you through South Dakota Foundation for Medical Care. So with that being said, let's dive into antimicrobial pathogens in the healthcare setting. Next slide. We all know there's germs in the healthcare setting. That's inevitable. We have people coming into us that are sick with bacteria, viruses, etc. Probably what's more of our concern, especially in this work that I'm doing with the healthcare associated infections, is that we don't want those coming into our facilities to become ill from something that happens within our building. And that is highly likely susceptible, those type of things, if we're not following the proper infection prevention and control practices. Renee did a great job of highlighting those and those standard precautions to really bring home some things that will help with preventing the spread of HAIs. A lot of times, or many times, these infections can be caused by antimicrobial resistant pathogens. So really these very harmful germs. The biggest concern with that is sometimes these can lead to sepsis or death, really because we do not have new antibiotics or medications to often treat these, nor maybe are we able to detect what even would be susceptible to attack these bacteria within a patient's system to help prevent this. If you look at the statistic at the bottom of the screen here, the CDC reported that in 2019, more than 85% of these antimicrobial resistant deaths were caused by 7 resistant pathogens from the healthcare setting. So that really brings home that we need to pay attention to some very particular areas in our work for infection prevention and control. Next slide. I'm just going to talk about some of these 7 briefly and go over one of the common themes in here, and you'll see we have it underlined and bolded, and it's that dirty hands piece. So the first one is carbapenem resistant. Oh my goodness, I can't talk today. That's perfect when we're doing these big words for presentations. Sorry about that. So really when we look at the carbapenem resistant Acinetobacter, we are seeing these are commonly found in soil and water. We know water management plans are a huge part of conversations that are happening because of the CDC's new water management program and ICAR that's available. So this is one that we can pay attention to. There's different signs and symptoms that are sometimes associated with this. A lot of times, as this slide says, the infection rarely occurs outside of that healthcare setting. So this is one that our patients are coming in and get infected with. It is UTIs, blood infections, things such as pneumonia and wound infections. Of course, it's spread through contaminated surfaces, contaminated equipment, and as I mentioned, those dirty hands. That hand hygiene is so very important, and I know we talk about it again and again and again. The next one that's highly likely to be a culprit of a healthcare associated infection is CRE. This caused about 13,000 or a little over 13,000 infections of patients that were in the hospital setting and 1,100 deaths in 2017. Same thing, again, you're looking at pneumonias, bloodstream, UTIs, wound infections, and this can be associated with meningitis. If you look at how it spread, dirty hands, wounds, the stool, and then of course that contaminated equipment and devices. So this is really where our cleaning in between each patient and proper cleaning and disinfection play a big role. Next slide. ESBL is one that's very common in healthcare settings and really across communities. If you look at the statistic, 197,000 cases in 2017 and 9,100 deaths from this. These are urinary tract infections and often bloodstream infections, and that common theme, dirty hands. Another one is VRE. We hear a lot about this. This frequently is found in the human intestine, the genital tract in females, and then again, the soil and water. So really looking at what are we doing? Renee mentioned like construction. So is there dust and soil and contaminants that are being brought into the building while construction's going on? What is our water management plan? Are we watching for different germs and bacteria in there? One thing with this, we know that it's resistant to vancomycin, and that's often one of those drugs that we use to treat a lot of infections, especially if we are struggling to get a patient well. Vancomycin might be something that has gone to. Just like the other ones, a lot of times they're the bloodstream UTIs and wound infections. And it's the contaminated surfaces and hands, again, that we're looking at as the main culprit of the spread and source. Next slide. MDR, or multi-resistant Pseudomonas, is another water and soil. It's the most common type among humans, and it's really resistant to nearly all antibiotics. This is one of those multi-drug resistant organisms that we have a hard time with. So when we talk about this, I just want to highlight, this one kind of talks about who is at risk. So think about those people that are on the ventilators in your facilities, those that have catheters or indwelling devices, those open wounds, especially from maybe surgeries or burns. And then, as we've talked about in the other dreams or other germs, it can be the UTIs and bloodstream infections. MRSA, or methicillin-resistant Staphylococcus aureus, normally found in the intestines. Again, this one also shows some resistance to vancomycin. People at risk. This one is something where we really need to provide some education to our patients. People have taken antibiotics for long periods of time. Our patients that had surgery are also susceptible. People with medical devices, again, in their body, and then hospital patients that have weakened immune systems. We know we are seeing them in our facilities, whether it's for things like chemotherapy treatments and those type of things, or maybe just because they've been so extremely sick that their body is just susceptible to more and more infections. Next slide. One more I want to mention is Candida auris, or C. auris. You might be hearing about it. This is something that, as my work through Project Firstline and the Department of Health has gone these last couple of years, we're talking more and more about this. This one is something that kind of started on the outside of the United States and has been working its way to the middle. This is a yeast. It can cause severe illness, and it spreads really easily among patients. Here we're looking at the bloodstream infections or wound infections, but one other that is listed by the CDC is ear infections might be a culprit. Of course, the medical devices within a patient's body, ventilators, are an increased risk in that immune system. And if you look here again, contaminated hands and equipment is known to be one of the biggest culprits of the spread. Next slide. This just shows a comparison of where these germs have been across the last few years, looking as far back as 2019 to 2022, kind of that pre-COVID, and then 2022. So as we are maybe starting to come down a little bit from COVID, if you see, really there's an increase in all of them when we look at 2022 versus 2019. Next slide. So there are some actions that we can take. Of course, it's following the proper infection control practices, screening at-risk patients, looking at patients who may be colonized or infected with antibiotic-resistant pathogens. We want to pay special attention to them. Patient education is huge, and then staying informed of the current outbreaks in our areas. Next slide. We also need to look at, especially as healthcare providers, improving our antibiotic prescribing. And this is something we've heard a lot about. There's the CDC's 7 core elements for antibiotic stewardship. That's a huge resource that really helps with our stewardship programs. There's some tips such as consider fungal infections for patients with respiratory illnesses rather than just going directly to antibiotics, watching for those signs and symptoms, and really educating our staff. What are the signs and symptoms we need to be truly aware of? And then performing the appropriate diagnostic tests to really guide our antibiotic therapy use. Next slide. We want to be aware of infections and the resistance patterns in our facility, in our community, and maybe even in our rural area, the surrounding areas around us. We do like to try to be notified by our lab if we're coming across antibiotic resistant germs. So make sure your lab's aware of that and to make sure you're the one that's being notified on that. And then really knowing when to report cases and submit those isolates to the health department. Next slide. All right, I mentioned Antibiotic Stewardship Week, and in South Dakota, Governor Noem has actually declared next week South Dakota Antibiotic Awareness Week. So she has a proclamation out, and we're going to be doing a lot of fun things during the week next week. One of the big ones is the Go Purple campaign. So wear purple in your offices, decorate your offices purple, light up buildings purple, anything you can really do to highlight purple and bring awareness to the concern with antibiotic inappropriate use, overuse, that type of thing. We will be sending out a toolkit that'll be coming through email. There's also a scholarship opportunity available for the Society of Infectious Disease Pharmacists. I actually am currently in this program. I have stewardship and pharmacy background prior to working in the role that I am. However, this has been a fantastic program. The scholarship covers and provides you with the program, and it's for allied health professionals. So it's not necessarily your nurses, your pharmacists, or your doctors that are in your facilities, but maybe somebody else, such as a lab or myself as a respiratory therapist, could take this and receive the scholarship and get this great knowledge and background to help with the stewardship activities at your location. All right, I know we've gone over a half an hour, so next slide, and I'll let Rebecca wrap up with anything else you might have. If you have questions, those type of things, please do not hesitate to reach out. You can go to the next slide, Rebecca.
Do we have any questions or comments today? I know, like Jess said, we used up all of our time, but we'll just take a moment just in case for anyone. All right, with that, thank you all for joining us today. Please, please, please scan the QR code and provide us some feedback. We really do value your feedback. If you have a recommendation for a topic that you might want to see, that's a great place to connect with us and tell us what you want from us. Here is also the QR code to connect you with South Dakota Project Firstline website. There's an example of some of the resources we have there and a ton of other ones. Feel free to check that out. Again, thank you for joining us. I know we're over on time and we all have busy days. So I would like to say enjoy the rest of your day.
Thank you, everyone.